Kana Guernsey here with Dr. Ron Girard, and today we are talking a little bit about Ron's journey. So Ron, what can we tell you about, what can you tell us about where you started with this?
My story is a lengthy one. I started out feeling symptoms, but definitely not being diagnosed till much later in my career. I felt symptoms as early as high school, but nobody knew what they were. You know, I remember going to the school nurse because my head was numb right here, and I was like, I don't know, 16. She was like, yeah, we don't know what that is. And so I went on and on like that, and I ignored it. And about 2011, when I started my job at Robert Packer Hospital, I had pretty acute exacerbation in which I couldn't walk. Like, I couldn't walk up the stairs. I was really freaked out. So everybody was in my family. And so I went into the emergency room the next day. And after like MRIs and all the stuff, then they finally said, yeah, we think you have MS. I'm like, what is that? You know, nobody in my family ever had that. What is that? And so, you know, I continued to work for another probably 7 or 8 years, you know, after that, until I couldn't anymore.
How old are you now?
I am 48. You know when you're old when you can't remember exactly how old you are.
So tell us how, when you finally found out that you had MS and it was actually a diagnosed thing, tell us how you felt about that.
Fear, you know. At that time, I had 4 children and a wonderful wife, and I was the breadwinner, and afraid, like, what is going to happen? Like, as if somebody just gave me a death row sentence, or I don't know, like if somebody just told you had cancer or something. So I didn't know anything about multiple sclerosis, even though I was a doctor, and I didn't know what to expect, you know.
As far as your wife Carolyn, how did she take the news from your perception?
You know, I think we were both in shock. You know, we didn't really know what to expect. You know, nobody's ever really been sick in my family, and so you're like, all right, that's good. We'll just get over that, and then we'll be back to normal. Like, you never realize it's going to be this huge, decades and decades worth of stuff. You figure, well, man, you got the chicken pox. All right, we're gonna get that, and then you're gonna be back to normal. No.
So in your journey, tell us what you did as far as like medication. What did you start with? Where did you go from your diagnosis?
Okay, when I was diagnosed, you know, I was at the hospital. A friend of mine was the neurologist that diagnosed me. He's like, all right, you got to go on to medication. You have 3 choices. You have Copaxone, you have Avonex, or Betaseron. He's like, which one do you want? And I'm like, I don't know. Which is the least side effects? He's like, well, this one makes you sick. This one, you know, this one's every other day. And so I started with Avonex because, you know, I at that point I thought it was the most researched and the most comprehensive, and that was just a once-a-week injection. And so that's where I started. I started on that. And then I found this swank diet. And so I did that, and I did swank.
So, okay, so you started on, you said you started on which one?
On Avonex. That's that beta interferon. There was a few beta interferons at that time. It was Betaseron, Avonex. There are a bunch of different forms of beta interferons, which all had shown some ability to delay, not disability, but to delay the onsets of exacerbations. And we all thought, well, geez, if you're delaying the onsets of exacerbations, then you're making progress, right? Found out later that may or may not be the truth.
So does Avonex in any way make you better?
You know, people could debate that onward and upward and get, you know, red in the face about it. But the reality is, if you really break it down, the question becomes, does it delay your disability status, or does it change your disability status? The answer to that is no. For Avonex, it's no. So it may delay the onset of exacerbations, which was acute symptoms. But over the course, we compare it, let's say, or we compare it over a year, we're like, wow, we had, half of the exacerbations you would have had if you didn't. Okay, great. Well, let's look at it 20 years, and it doesn't delay the onset of disability or...
So you said you also started with Swank. So for how long did you do Swank?
A long time. I'm going to say 8-9 years. It just kind of, it fed into the status quo. Low fat, saturated fats are bad. Eat as much sugar as you want. Eat as much, bread as you want, all that. Just stay away from those bad fats. And so that was the thing. Everybody was like, low fat this, low fat this. And so it made sense. I'm like, yeah, those fats are pretty bad. Don't eat any eggs. Don't have any saturated fat in the meats. Don't eat very much meat. But everything else. So, my wife and I, we used to live off snack wells. I don't even know if you know what they were, but there's a little like sugary cookie dietary things. They're horrible, right? And TCBY yogurts, everything. So I would like sugar and pretzels. I would just eat those all day long, but I just kept getting worse and worse.
So start to tell me a little bit about when you got to the point to where work started to become not an option.
Okay, so the progression is this. The first time that I was diagnosed, I had trouble walking up the stairs, trouble walking, right? But then they give you IV Solumedrol, which is an IV corticosteroid, which is not the muscle building, corticosteroids, but it's the feel good steroid, right? And the whole
show us those muscles again.
Anyways, yeah, maybe we could go into this later, but so the whole idea is that you're under an acute inflammatory process, whether it's a break in the blood-brain barrier. I don't think anybody really knows, but you're under acute inflammation. So you give them these corticosteroids, Solumedrol is usually the one they use, and it's given it usually a gram a day for 5 days, and it just shuts down all inflammation. And so after that, you feel great first couple of days, then you feel kind of icky. But then after that, I was back to normal. Like, all right, this is great, I'm cured. But no. So I did that, and I went back to work, and everything was, it took me a couple of weeks, got back on my feet, and it was fine. And then slowly but surely, the next one happens. And then I went to a cane. I was using one single cane. And I did that for a long time, maybe a couple of years with just one single cane. And I got really good at the cane. And, patients would ask me what's wrong. I'm like, oh, my back hurts or something or other. But then it went from cane to forearm canes, 2 canes. And then, fast forward 8-10 years later to a full-blown wheelchair. For safety's sake, I could probably get around with those type of things, but I began to fall a lot. I think I even broke a little piece of my chin once. So my wife, being a physical therapist, no, we need safety. We can't, you
safety
can't.
First.
Yeah, she's like, I know why you can do it, but you're not. So, and so that's how I ended up in the wheelchair.
So tell us a little bit about, just go to kind of where it was at the worst. Give us a little picture of where you got to before you started to make your climb back up.
Okay. So the progression is this, and I kind of went through all the different drugs, and I kept looking at, the beta seron or beta or Avonex, and there's, Tecfidera. All these new drugs came out, and, I went on this huge search. I went to the Mayo Clinic. I went out in Cleveland. I went to Philadelphia. I had a little bit of the means back then, so I was able to, search out, all the best doctors. And, there was a gentleman I saw in Philadelphia, and I couldn't remember his name to save my life, but he was one of the leading MS guys and doctors and neurologists. And, he told me quite frankly, he's like, I wouldn't do any of the medications because they're long-term status hasn't been proven, and you may shut down the immune system for a couple of years, but then your body's gonna come back. So I went this big, come back even worse than before. So I went this big surge, and I did Chinese medicine, I did Ayurvedic medicine, I searched everywhere. I mean, I almost started the bee stings, and I didn't do that, which is good because that's proven not to be anything. So I looked at everything. I had holistic, healers, and I was taking every nutraceutical, every supplement, but I was still eating, the breads, and I was still just not really having a grasp of my diet. And then I, probably with most people, I end up watching a TED Talk for Dr. Terry Walls. I'm like, what is she talking about? Like, she's going against everything I ever learned. Like, you can't eat like bacon. That's like so illegal, and or any type of fats. And she's 9 cups of vegetables. That's craziness.
So tell us, you're a doctor. Tell us a little bit about your feelings on, you talk about some of these alternative therapies. How do you base your decision on trying a new therapy?
It's really tough because all of a sudden, I don't care what kind of education you have or what type of, what your profession is. But when you're told you have an incurable disease, most likely it's progressive, meaning it's not going to get any better. It's like the one nurse explained to me, well, each time you have exacerbation, you bend over a little bit, and then you can stand up a little bit more, but eventually you keep bending over until you just can't anymore. This was kind of her idea of, you're never going to come fully back to normal. You may come back a little bit, but never going to go all the way back. So, yeah, that's a great question. Like, how do you, I'm an oral surgeon, right? How do you filter through all these? Because everybody and your brother will come up to you like, oh, you gotta try this shark cartilage, you gotta try this, you gotta try that, this supplement. And so, it took quite a few years for me to get a bearing on what was even possible and what was just not, like, just nonsense, right? And there's a lot of nonsense out there. And so when I read Dr. Walt's book, it made such complete sense. I'm like, wow, this lady, she's really got it. She's broken down everything, and everything she's talked about is backed up by good research and
science.
And science, and I'm like, all right, well, I was kind of, even though I was in medicine, right, I was beginning to demonize medicine. Like, all right, they don't know what they're talking about. But there has to be a median. Not all doctors are bad, not all medicines are bad, not all pharmaceuticals are bad. But where are we going to find the truth? And that's what we're really looking for. And so that's what I began to search. Still staying on the medications. I went from Avonex to Copaxone, and I have like $10,000 worth of Tecfidera in the shelf over there that my neurologist like, all right, you got to try this one. This is the new one. This is going to be great. And so I took it home and I put it on the counter, and at this time I was having this Korean doctor, not really a doctor, he's just a healer. He would come over and like massage me, but it wasn't a massage. It was like I had bruises like the size of my fist, and
more rolfing or deep tissue work.
And he claimed that this is what you need, and that. So I was like literally praying as he worked on me. Because the pain was like, my wife had children, so I can't complain much, but but it hurt. And so, and at that time, just back up a little bit, what was I on? I was on Prozac, I was on thyroid medication, I was on an inhaler, I was on something to help me go to sleep, something to help me wake up, diazepam, Valium to go to sleep. Waking up, I was on New Vigil. Let me think of the other medication. I don't know. I felt like I was my grandmother because she had like a whole medicine cabinet full of pills. I'm like, how is this possible? I'm like, 30 years old, and I'm like just.
Where was your disability level at this point?
When I was on all the multiple medications, everything. At this point, I was using Forum canes, and I wasn't very safe on them. I was just getting by. So even to the point now where it progressed so much that when I lay down in bed, I couldn't roll over. I mean, I was incontinent. I was considering, having to wear a diaper. I was, it's kind of weird. They call it the MS. I mean, you did a lot of research, right? They call it the MS hug. But it really just meant I couldn't breathe. And I would do inhalers, but I wouldn't get any better. I wouldn't be able to catch my breath. So, it became very, very scary. I thought in my head, and I wasn't going to tell my wife this, but I'm like, I'm not. I can't roll over in bed. I can't sit up on the couch. I don't even know when I'm going to be able to get to the bathroom next, So pretty scary, yeah.
Thank you for sharing that with us. That's really one of the hardest things, I think, for a lot of people is that dark place where you don't know what to do